Hi students, welcome to week 3 of Medical Terminology 2. This week we're going to discuss the nervous system and mental health. The central nervous system consists of the brain and the spinal cord. The meninges enclose the brain and spinal cord for protection, and it is made up of 3 layers of connective tissue: the dura mater, the arachnoid membrane, and the pia mater. The peripheral nervous system has 12 pairs of cranial nerves and 31 pairs of spinal nerves. There are 3 types of peripheral nerves, which transmit signals to and from the central nervous system. They include the autonomic, sensory, and somatic nerve fibers. Next, let's look at word parts of the nervous system. The word part for cereb means cerebrum or brain. If you see the O there, that connects the word part to the other part of the word, which may be a prefix or a suffix. Concussion means shaken together, violently agitated. Encephal means brain. Mening means membranes or meninges. Myel means spinal cord or bone marrow. Nerve means nerve or nerve tissue. Nervous system medical terms. Cranial hematoma is a collection of blood trapped in the tissues of the brain. Cerebral contusion is bruising of the brain tissue as a result of a head injury that caused the brain to bounce against the skull. Cerebral palsy is a condition characterized by poor muscle control, spasticity, and other neurological deficiencies. Encephalitis is the inflammation of the brain. Other nervous system medical terms include the hemorrhagic stroke, which is damage to the brain that occurs when a blood vessel in the brain leaks. Ischemic stroke, which is damage that occurs when the flow of the blood to the brain is blocked by the narrowing or blockage of the carotid artery. Multiple sclerosis is a progressive autoimmune disorder characterized by inflammation that causes demyelination of the myelin sheath. Sciatica is inflammation of the sciatic nerve that results in pain, burning, and tingling along the course of the affected nerve. Now let's take a look at mental health. Anxiety disorders. These are mental conditions characterized by excessive, irrational dread of everyday situations or fear that are out of proportion of the real danger. So there's a few types, and the first one is generalized anxiety disorder, or called GAD, and it's chronic excessive worrying. Panic attack is unexpected, sudden experience of fear in the absence of danger. Post-traumatic stress disorder, or PTSD, may develop after an event involving an actual or threatened death. Next, let's look at phobias. Acrophobia is an excessive fear of heights. Agoraphobia is an excessive fear of environments where the person fears a panic attack might occur. Claustrophobia is an abnormal fear of being in a small or enclosed space. And social anxiety disorder is an excessive fear of social situations where the person fears negative evaluations by others. Neurodevelopmental disorders include dyslexia, learning abilities, intellectual disabilities, and autistic spectrum disorder. Psychotic disorders are characterized by the loss of contact with reality and the deterioration of normal social function. And examples of those might be catatonic behavior, delusion, hallucinations, or schizophrenia. Substance-related disorders are alcoholism, delirium tremens, drug abuse, and drug overdose. Medical terms for mental health include autism, a subgroup, Malingering, which is characterized by the intentional creation of false or grossly exaggerated physical or psychological symptoms. Delirium tremens is a disorder involving sudden and severe mental changes or seizures caused by abruptly stopping the use of alcohol. Dementia is a slowly progressive decline in the mental abilities, including memory, thinking, and judgment, that is often accompanied by personality changes. Schizophrenia is a psychotic disorder characterized by withdrawal from reality, illogical patterns of thinking, delusions, and hallucinations. And then finally, we have psychotherapies. Psychoanalysis is based on the idea that the mental disorder have underlying causes stemming from childhood and can only be overcome by gaining insight into one's feelings and patterns of behavior. Behavioral therapy focuses on changing behaviors by identifying problems, behaviors, replacing them with appropriate behaviors, and using rewards or other consequences to make change. Thank you for listening.